My expectations are to see as much as I can see during the day, to learn as much as I can from the day, to do my best to give the best care to my patients that are on my service. So really, the focus is on education. It's on learning more about medicine. It's about learning more about how I'll be able to take care of my patients better when I'm out on my own.
Now, on top of talking with the patient, asking questions to get a good assessment, and charting, a big thing that I picked up on it was a lot of bedside manner.
Oh, absolutely.
How important is it?
I would say bedside manner is very important. It changes your whole interaction with the patient. If there is conflict with the personality, sometimes that's difficult to overcome and to get a patient and their family to trust you if for some reason they don't seem to click with your personality. But most of the time, I would say most physicians have a fairly good bedside manner that do go into it. There are some exceptions, some are better than others, but for the most part, communication is huge in medicine, and being able to talk with the patients and have them be comfortable when you're talking to them is very important.
I didn't understand most of what you were talking about when you were talking with other doctors.
Okay.
How important is it to get consult with other doctors that you work with, or even the nurses?
Okay. As far as just talking with other people involved in the care, it's very important. The main thing, again, is communication. If we don't communicate well with people, the care can definitely be substandard. So we definitely think it's important to have good communication with our staff and with our nurses and the other physicians involved with the patient's care. It's very important.
Okay, now sticking with consulting with other doctors and the language that I didn't understand.
Okay.
When you talk about different medications, how do you break that down? Do you have an idea of maybe what you should give to someone and then consult with another doctor? How does that work?
Really, the consulting comes in where, for some reason, we want the expertise of someone who is a specialist to look at the case. Sometimes they give us their opinion and continue to follow with us along with the patient. Sometimes they stop by once, give us their opinion, and let us manage the patient. And that's up to the comfort level of the specialist and the severity of the problem that they're consulted for.
Now, I picked up on a lot of different drug names. How do you have a mental catalog of what?
We start taking pharmacology usually in the second year of med school. They start off with all of the generic type names. We learn all the generic names. And as we come out, we learn more of the trade names. And that's just, we don't take a course in it. You just get exposed to them more, and you learn what the generic names are and what the trade names are. And as you get more experience with it, you get more comfortable with the names. We do consult, obviously, either a PDA or a pharmacopoeia to look up dosages from time to time and to jog our memory on some of the drugs in certain classes. So I don't think anyone knows all of the drugs. There's too many of them out there. Even the pharmacist wouldn't be able to do that. But the ones we use more commonly we know pretty well.
So what's your interaction with drug companies, or do you have any?
Well, it's pretty limited. It all depends on where you're at. We no longer have any drug reps come and sponsor any meals or anything here at Bromen. Every place is different. Some big university hospitals have adopted the same policy where they don't allow drug reps to come in to the hospital in that fashion. In the past, that was very frequent, where drug reps would come in, bring lunch, talk about a certain drug or a certain medical problem that's used with that drug, or that you would treat that problem with. So I would say that was very common, and now it's few and far between. Occasionally there will be a speaker, like a physician, that comes and talks about a certain topic, and then it's sponsored by a drug company. But it's been a long time, actually, since I've been to one.
Do you stand one way or another on the proposed Obama healthcare plan, or no?
Well, I don't take sides on that type of thing. I think that there are a lot of areas that healthcare can improve. I think it's going to be a very difficult change. There needs to be a lot more money put into a system in order to get it to work the way that President Obama has proposed. I think there's going to be a long road ahead of us. I think we will see change. I think there will be positive and negative things from it. But I do think change is needed. I agree that change is needed. I don't know if I agree on every aspect of his plan. I haven't reviewed it page by page, but I do think that there is a need for health care for the uninsured American, and I do think that our country will be a better place with that in place. I think the problem that he's already seeing and that we're running into is how do we fund that program, and how do we use our healthcare dollars. We have a lot of money in this nation, but the way that we divide that money is limited, and the budget only goes so far, and we spend a lot of money on defense in this country. Other countries that have more access to a government-sponsored health care or plan generally tend to spend less on defense. And I don't know if that's something that they'll be able to really change just with the way that our history has gone in this country. We've always been very, I don't know what the appropriate word is here. We've always put a lot into our national defense and that budget, and I'm not sure that will change anytime soon.
Interaction with health insurance companies. I'm sure we've all heard, some people have problems, some people don't. How do those kinds of things affect you in your job, or do they at all? Does health insurance really come into play for you?
It does. When it does come into play, if someone does have health insurance and we would like to put them on a medication that is not covered by that plan, either myself or one of my nurses has to contact the insurance company and try and obtain approval for that medication. Obviously, all insurance companies have a formulary. They have something that they allow their patients to be on, and other things that they do not pay for first line. And it is something they use for cost containment and trying to keep costs reasonable. But that doesn't always fit the picture that would benefit the patient the most. So occasionally we do have to try to get what the patients may need, even though it may not be covered by their insurance. So there's a lot of red tape, a lot of paperwork involved in that, time on the phone. It can be difficult to deal with. It can be frustrating, but it is part of the job. We are here for our patients. We need to be an advocate for them, and occasionally that involves trying to get an approval for something that may be difficult to do.